For the mild to moderate cases where the soft tissue is affected more, you need to do fat grafting. It's a very simple procedure where we do liposuction from your abdomen and thigh, get adequate amount of fat, and then we inject into the areas which are atrophic or depressed on compared to the opposite side. So we mark those areas, we inject and plump up that area. Fat, as you know, gets absorbed over a period of time, in the sense if we inject 100 ml of fat, about 30 to 40 ml may get absorbed over 6 months. So at the end of 6 months, we assess the result of fat grafting. If there is a little bit of residual asymmetry, then this procedure is done again to give a better result or to give a perfect result. Now, how do you treat a severe form of hemifacial atrophy, especially when they present with very badly affected skeleton, or sometimes even the bones can get eroded and in fact they get damaged? This needs to be done at an early age. That means if the child is presenting at 10-11 years with a very flattened face, we need to treat him, because it's going to affect his confidence. The child will say, I'm not going to go to school because my peers make fun of me. So this will really affect the development of the child. So in the first stage, because the skeleton growth is not completed, we address the soft tissue defect. We reconstruct using a free flap. A free flap is tissue taken from the thigh or elsewhere from the body along with its blood vessels. We put that tissue beneath the skin on the affected side, and we do anastomosis, that is join those blood vessels with the blood vessels in the neck. That whole thing survives and gives a good appearance and quite a bit of symmetry compared to the opposite side. But remember, we have not addressed the skeleton yet. So as the child grows, there will be a possibility that the growth of the bones is not taking place because the bones are already destroyed. So once the child is then 18 to 20 years, that means once he's an adult, we do a CT scan and then we assess the amount of residual bone deformity which needs to be corrected. We then use cartilage grafts or bone grafts to address this deformity by reconstructing the infraorbital rim, that means the lower border of the orbit, and by putting a bone for the jaw or for the cheekbone or for the upper jaw. So in this way, we do a CT scan, we can do a 3D reconstruction, we can specifically design the bone that we need to symmetrize the skeleton of the face, and at that time we can superimpose with a little fat grafting to refine the soft tissue deformities that may be present. So hemifacial atrophy needs to be treated. The timing of treatment will depend on the timing of presentation, and these children have to be kept on follow-up and they have to be made aware as to how the natural course of this disease is. But yes, it gives a very satisfactory result and it really boosts the confidence of children.